Okay, well, I'm very pleased in this next section of the conference to welcome Professor Olavi Kangas, who is the director of the Equal Society Research Programme at the Academy of Finland and Professor of Practice at the Department of Social Research at the University of Turku. And Olavi Kangas is, I think, very well known for having been the person that set up and designed the evaluation of the basic income pilot in Finland. A pilot which achieved a lot of worldwide recognition. The first time there'd been a national statutory randomized field trial of basic income. So it's a great pleasure to have Ollie say some words to us today about that pilot scheme and what it did and what we can learn from it. So welcome, Ollie. Thank you very much for joining us. Can I just ask you to start by saying a little bit about, why was this basic income experiment set up in Finland?
We had the new government, its governmental program 2015, the government that was center-right government. They simply said that we will have a basic income experiment, and they said nothing more. And by now, I actually don't know why that kind of paragraph was written in the governmental program, because there were a kind of wrong parties in the government included who started this. Usually in this country, the Greens and the left-wing party, they are in favor of basic income, whereas the center party that was the Prime Minister party, they are a little bit in favor of basic income, but not very much doing for that. And then the Conservatives and the True Finns, the two other parties that were included, they are against basic income, so that it was a little bit strange combination. But the motivation was that let's have this experiment and study if basic income is good for employment, so that the employment and the employment effects were the target and the main issue of what they wanted to study.
And can you say then a little bit about how you went about taking that, paragraph in a coalition government's program, committing to this pilot? How did you go about then actually establishing a pilot and getting one to work with all the kind of complexities that involves?
They gave a little bit money for planning, and there was a competition of those resources, and then my team that included sociologists, social policy people, then lawyers and economists and statisticians. We won the competition, and then the marathon run or ultramarathon run began. And then the problem was that we were somehow working in the darkness, so that nobody said that what they wanted to have and how they wanted us to plan. The only thing they said that we should evaluate full basic income, meaning that the level had been something like 1,500 euros a month, and then the partial basic income, negative income tax, and then participation income. And then very soon we realized that it's impossible to have that full basic income experiment, because we had only 20 millions in our running budget or experimental budget, and it has been very, very few people that had been included in the experiment with that kind of money. And on the other hand, that the 100 or 1,500 euros had been that high that very many those people who are getting unemployment benefit from the unemployment funds, they hadn't, it had been more what they are getting from the funds. And in that case, there had been an institutional resistance coming from the trade unions and coming from the funds, that you can't have that kind of model. And then we thought that, okay, we will not experiment with that kind of model that is impossible to implement. And then the negative income tax was impossible to experiment, because in that time we didn't have a proper income register in this country. The income register was at that time working at annual basis, and that's a too crude measure. to have a basis for experiment. Nowadays we have almost updated income register that is working on a monthly basis, or not a daily basis, but at least a monthly basis. So that now it was possible to have that kind of model. And then as regards to participation income, mimicking Anthony Atkinson's idea, we thought that we don't have that kind of bureaucracy or possibilities to screen what people are doing and which kind of work is that kind of work that it should be rewarded by basic income or participation income. And then we said that no, we don't want to have that. And then at the end of the day, we had that partial basic income. And the level was set to be 560 euros, what is the minimum level in net terms a month, what the unemployment person gets if he or she is getting nothing else.
And so so there were, I think, 2,000 participants. Is that right?
Yes. In the very beginning, we had very ambitious plans to make the best possible experiment ever. It had been nationwide. It had been randomized. It had been obligatory to avoid selection bias. And then there had been local experiments in some municipalities to get the community effects. But very soon we realized that it's impossible to do in that way because the government said that they will not give us more money. So that we asked that we could do that kind of fancy thing or better experiment if we had something like 40 to 70 million euros. But they said that, okay, you have those 20 millions and that's all. And then we had to do selections. And then we decided that, okay, we take unemployed persons who are getting unemployment benefits from social insurance institution. That was my employer at the time. And the reason, or there were several reasons why we took the unemployed persons. First was that when our running budget was 20 millions, and we thought that as long as a person is unemployed, instead of using and utilizing our experimental budget, we can take money from the unemployment benefits and somehow mimic or pay them out as a basic income, or in the same principles, or following the same principles of basic income. But immediately when the person finds employment, in that case, we will pay his or her basic income from the experimental budget, so that then we could expand the number of people to be 2,000. And then the other reason was that we were in extreme time pressure, so that we had only 1 year to plan the experiment, and we had only 1 year to plan the legislation. Because this was an obligatory experiment, we had to write experimental legislation. And it takes time, because we had to try to anticipate all possible transitions in a person's life who was included in the experiment. What will happen if she gets child? What will happen if she gets sick? What will happen if she begins to study, etc., etc. So that it took time, and sometimes we thought that it's impossible to carry everything during that time period that was given to us. And sometimes I said to Prime Minister that, look, it's impossible for us to plan it, and if we can plan the experiment and the things related to the experiment, is it possible that you will have time to write the legislation or to accept the legislation in the parliament? Because usually it takes time in all countries to pass a law, first governmental bill, and then discussions and hearings and etc., etc. So that it was tight time schedule, and sometimes we lost our faith that it's impossible.
But you did it, and so the pilot started in 2016, I think, and it lasted for 2 years.
Yes.
Can you say a little bit about then what the results were of the pilot? So it's 560 euros paid to 2,000 people nationwide who are also in receipt of unemployment benefit and don't lose the basic income if they go into work. So they retain it if they start to work. Could you say something then about the results of the pilot, what you found?
We are still evaluating the experiment, but up to now, our conclusions on the basis of registers. We have lots of registers and lots of possibilities here in this country to merge different registers so that we have registers on social security, who is getting what, and then we have income register, and then we have employment register, and we have possibilities to unify to all those registers, for example, medical registers, so that which kind of medical diagnosis people have and which kind of medicine they are eating, if they are eating something against depression, or if they are whatever they are eating, so that we have not yet done that. But what the government wanted us to do in the first place was that we had to study and say something about employment results. And the employment results show that those who were getting basic income, they had a little bit better employment record than those who were in the control group. And the experiment that we had, there are many problems, but one of the strong point and the strong side in the experiment is that in the beginning we had two identical groups, the experimental or treatment group and then the control group. And they were identical in the beginning of the experiment. And then we can draw very strong causal explanations and consequences in the case that we find differences in the end of the experiment. Then we can say that the differences are caused by the treatment. And we found that there is difference in favor of those who were getting basic income, but among those 2,000 persons, it was not statistically significant, but it was significant among immigrants and among those who had families. And the reason is that usually those people who were getting basic income and who were immigrants, they were younger and they were healthier. And also those who had families, they were younger and they were healthier, and their distance to labor markets was a little bit shorter than those who were older and who perhaps had some health issues, etc., etc. So that was the main result as regards employment. And then we carried out a survey, and that survey showed that the treatment group had much more positive view of their lives, and they were more self-reliant and more self-confident in that sense that they thought that, okay, I'm a master in my own life and I can make my decisions, and what I do has some meaning. And our results in that regard is rather much similar with those results what they have gotten in Germany, Mein Grundeinkommen. They interviewed people who had gotten basic income in Germany, and what they said that okay, the one thing is that I'm somebody. So that also in the Finnish experiment we found that people had a better self-respect when they had gotten basic income, and also they had more trust. They trusted more in society and social security, etc. So that the psychological effects were rather positive here. And then what we are doing now is that we are analyzing interviews, so that we had something like 80 face-to-face in-depth interviews, and we are just now analyzing them.
That's very interesting. So the findings that people have a stronger sense of security or status, and that also that they have higher trust in social institutions, is that related to the level of the money, that they're just more secure in their lives, or is it that they are then, because they're receiving this guaranteed income, they feel themselves to have more status and security in society?
I think that both aspects, in that way that the money was not that much. It was very, very small money. But they knew that the money will be there in the beginning of every month. Whatever they do, they don't need to go to the Social Security Bureau and explain to a bureaucrat that I have done this and that, and I have been active, and please give me money, or if my activity is enough to give entitlement to that benefit. And also people felt that it's some kind of guaranteed income, and it's an income that comes to me, that's paid to me because I'm a human being, and it's not a mercy. That it's my right to get it.
Yeah, so they're not subject to charity or to
and also they are not that much subject to bureaucratic handling and bureaucracy. And we had questions about bureaucracy, how much people felt bureaucracy, and those who were in the control group, they had much more experiences of bureaucracy and thought that the bureaucracy is too tight. Of course, those people who were in the basic income experiment, they also felt that there's too much bureaucracy because on top of basic income, very many of them got something else, housing allowance or something like that, and they had to apply to that, and sometimes it was not clear for the clients who were getting basic income, what's basic income and what's then housing allowance and what's something else what they were getting. Yes. So that it has been much more simple in the case that it had been 1,500 years and then nothing else, so that it had been easier to understand the mechanism. Yes. And what's the money is, but now they had to operate in different bureaucracies also, in some cases, not always, but in some cases.
Yeah, and so there's a lesson there about the interaction of a basic income with other elements of a welfare state, whether it's housing or disability allowances or other provision that's made for individual need.
Yes, and that's perhaps one lesson to be drawn from Finnish experiment is that if we have small basic or partial basic income, in that case, we have to plan how those benefits are interacting, so that the basic income on the bottom, and then how those other benefits are floating on top of basic income.
And so your pilot was, much kind of talked about, observed around the world. There was suddenly lots and lots of attention on what you were doing in Finland. I wonder what, for people watching this who are thinking about trying to set up a pilot, or who live in countries where there's political commitment, whether at the sort of city level or the national level, to basic income. I mean, what sort of, in addition to what you've said there, what sort of other lessons would you offer from your experience to those people in other countries?
First thing is that we need money. Second thing is that we need time to plan properly everything, and then there must be inspiration and perspiration and preparedness to have that perspiration part. So that it's a hard job to plan everything, and especially if you have to write the legislation, it's a nightmare in that sense that it's easy to say that let's have basic income and let's have a basic income experiment. But if you try to implement basic income experiment, the existing social security, it's a very hard task. That it is much easier to have a basic income experiment in a country that they don't have so many benefits as we had, or as we have here in Finland and in the Western world. So that those are the lessons. And then, of course, we can criticize this kind of randomized nationwide experiments that people are not isolated islands here and there, but they are interacting with each other. And if you have a nationwide experiment, in that case, we can't grasp that interaction. And therefore, the best thing had to be if we had possibility to have a nationwide experiment, randomized obligatory experiment, and then a local experiment where we could have gotten that community effect.
Do you mean thereby that we should have the combination of national trials with everybody in a particular community, a locality, a town, or even a city, getting a basic income, so you can see the community effects of everybody receiving one?
Yes, so that preferably everybody, or if that's not possible, there should be very high take-up, or in that way that there would be a kind of income limit as they had in Canada when they were experimenting with the negative income tax there. So that the good thing with that kind of national experiment we had is that whatever happens in the country, those happenings are hitting both both groups, the experimental group and the control group similarly, so that they are not damaged in the case that the unemployment goes up in the country or if it goes down. But if you have a local experiment, they are very sensitive to internal shocks. That if a big employer stops there, then there are lots of unemployed people, and we can't say, and what's the role of the closer or that enterprise, and what's the role of basic income, so that the whole experiment is destroyed, as happened in a couple of experiments in the States in 70s, 80s. So that my idea is that the more we have nationwide experiments and the more we have those local experiments, then we can combine our visions and views and results from experiments. Because I would say that how excellent experiment we ever had, in that case, it's not good enough to answer to all questions that we have about basic income. Instead of answering to those big issues, we have to answer to small issues and small questions, and collecting data from different experiments. For example, from Canada, from Finland, from the US, from Scotland, possibly from Germany, from the Netherlands, etc. And then we can get a more comprehensive picture and look at the same phenomenon from different angles.
Yeah, very good. And I suppose just one final question, Ollie, is that you know, a lot of people have said with the COVID pandemic that it has exposed lots of sort of gaps and holes in welfare states across the world. That, you know, plenty of countries, and not just developing countries, but, you know, advanced economies like the UK, where the welfare state has simply not been adequate to provide people with security in the crisis, and that lots of ad hoc measures have been needed and have been taken, and that instead, if a basic income had been in place, it would have been there as for everybody, ensuring that in this public health emergency where everybody is affected and the economy has to be locked down in many countries, that you have the security you provide. So a universal income and the delivery of a universal income is a way of preparing our societies against future pandemics or shocks of that kind. I mean, what do you feel about that versus the sort of argument that you otherwise hear, which is that actually, so you're existing welfare states that have to do the work in these crises, and you shouldn't be trying to invent new things?
If you start from what you said, the last thing, that we have invented ad hoc measures to somehow repair those holes in the safety net, because the pandemic has shown that there are lots of holes here, and there, and lots of new things introduced in different countries. And here in Finland, we have not done that many ad hoc corrugations or taken ad hoc measures. And the reason is that it has something to do with the universalism and the universal characteristics of the Nordic welfare state. The main thing here, what they have done, is that they have introduced the right to self-employed persons to get unemployment benefits. Because very many very many self-employed people, they have not paid the unemployment benefit fees because it's voluntary in this country, and in some cases they are not entitled to basic unemployment compensation that we have also. And then the government decided to make the basic unemployment benefit available for everybody, so that they introduced the temporary measure. And it's interesting to see if the temporary measure will be permanent. Very often it happens that, to my mind, that's a kind of small step towards basic income. So that in Finland, it's perhaps politically a little bit dangerous to say that we are taking steps toward basic income. But what people and all political parties here in this country say, that we have to simplify our basic social security net. And instead of calling it basic income, we could call it basic security and more tight basic social security safety net. And just now we have here a parliamentary committee that will work for 7 years to try to solve those problems that we have in our safety net. And it's very interesting to see how basic income will be treated in that parliamentary working group.
And that is a very interesting and perhaps optimistic note to finish on. And I think we've had the same here, that we've had grants made available to the self-employed because they weren't able to access other forms of support, what we call the furlough scheme and other measures for supporting people losing their jobs. So this, in a sense, there's been an impetus towards trying to secure universal coverage, even in a very means-tested residual liberal welfare state like the UK. So it's an interesting parallel to Finland, where you have, as you say, much more universal. The Nordic universalism is much more fully embedded. Even there, you've had the extension towards self-employed people. Thank you very much, Olli. That is really, really helpful, and I'm sure everybody watching this would have learnt a lot from what you said there about the trial, the importance of the long haul. I took from what you said that you've got to be patient, you've got to get your legislation through, you need decent money, and you've got to stick to your guns over a period of time. So for basic income advocates and politicians,
and you should have endurance, so that it's not only marathon, it's ultra marathon. And when you are finishing and thinking that now it's finished, then they will say to you that you will run one more round. So that's really. And when they are saying that the final results were published, I would say that it was not the end of analyzing and not final results, but it was end of the first result, so that now once again the run begins, and we are prepared for ultramarathon again.
So universal basic income is the ultra marathon. Thank you very much indeed.